The first item on the agenda is House File 3766 from Representative Hansen. I will move House File 3766 be laid over for possible inclusion. Representative Hansen, to your bill.
Thank you, Chair, and thank you, committee members. House File 3766 seeks to expand our caregiver program to allow patients to assign their homegrown plants to a caregiver. With half the nation allowing people to grow cannabis at home for medical and/or adult use purposes, including Minnesota, it's important that we do not leave Minnesotans on our medical program out of the opportunity to benefit from homegrown cannabis, especially if they simply need help doing so. To support people with disabilities and their request to allow their caregivers to help them benefit from homegrown cannabis, this bill seeks to increase the number of plants allowed for people on the medical program from 8 to 16 and to allow them to assign their plants to a registered and trusted caregiver to grow on their behalf. We do not think that people with qualifying medical conditions on our medical cannabis program ought to be left out of the ability to benefit from homegrown cannabis simply because they are unable to grow it by themselves. As it stands today, people with disabilities and conditions that qualify them to be on the medical program can only grow their own if they know how to, if they can afford to, if their condition or living situation allows them to, or if they know someone who will gift them homegrown products. As we all know, conditions like those that qualify folks to be on the medical program, like ALS, cancer, chronic or intractable pain, IBS, or other conditions that impact the body and mind, are often chronic and debilitating. But cannabis can significantly improve their quality of life if it is the right medicine for them. Patients on the medical program can obviously purchase products from the medical dispensaries. However, these products are often too expensive and inaccessible to them. Allowing patients to assign their home-growing rights to their caregiver will ensure that people with qualifying medical conditions on the medical program can benefit from Minnesota's home-growing laws. Patients choose their caregiver, and caregivers already can assist a medical registrant with accessing their cannabis in a variety of ways. But in this bill, the medical registrant could also get help growing their own, and those caregivers generally also have experience growing cannabis in their home. They may already have grow equipment like soil, lighting, and tents, and the experience that these patients would need to help produce the plant that they benefit from so much. You can find our existing medical cannabis caregiver program language in Section 4 of the bill before you, and that already allows patients to designate a caregiver if the patient requires assistance in administering the medical cannabis or obtaining the products or paraphernalia from a dispensary. And this bill simply builds upon our existing and so helpful caregiver structure. And with that, Chair, I'll turn it over to my testifiers.
Thank you. We do have some people who signed up to testify. I'm going to say this to the whole audience and anyone who's planning to testify at any bill today. We have a lot of bills on the agenda. It's going to be a challenge to get everything in, so please, we're asking everyone to limit your testimony to 2 minutes. When we get to 2 minutes, I'll politely ask you to wrap things up. Our first testifier is Kayla Fearing, who will be followed by Aaron Jensen. Ms. Fearing, if you want to come forward, state your name for the record, proceed to your testimony. Welcome to the committee.
Hello again. Hello, Chair Stevenson and the Commerce Committee. Again, my name is Kayla Fearing, and I am a patient advocate, healthcare consultant, and cannabinoid educator. I spent the last year and a half getting feedback from Minnesota patients, home growers, and the cannabis community on the possibility of a caregiver program here in my home state of Minnesota. I've been a medical cannabis patient in the state of Michigan and a patient using their caregiver program since 2021. I have seen the success of a cannabis caregivers program personally in our neighboring state of Michigan. 11 other states currently have and are operating a cannabis caregivers program similar to what the Minnesota community has asked for in HF3766. Patient and plant counts for caregivers vary state by state. A caregiver program establishes a contract between a contract-based relationship between a patient and a caregiver. A caregiver under HF3766 can provide individualized cannabis for their patients, products that cannot always be purchased or even found in a medical or recreational dispensary. With Minnesota's strong historical backgrounds in healthcare and agriculture, we've already had the seeds in place to establish an amazing caregivers program. HF 3766 would first and foremost create patient accessibility and patient choice within our Minnesota medical cannabis program. Even in other medical programs, dispensaries Dispensary-bought flower has many inconsistencies. Minnesota's current shop choices are reportedly no better for patients. Minnesota patients have reported paying top dollar for existing medical products that contain mold, mildew, or old dried-out cannabis flower, questionable THC potency percentages, again, with one of the most expensive price tags in the country. A caregiver program would provide a local and craft choice for patients to receive their high-quality cannabis flower medicines. HF3766 shortens the gap of entry, becoming an entrepreneur in cannabis as well, allowing caregivers to share their services and producing home-grown cannabis to the medical patient community provides a path for small businesses for one person, particularly in underrepresented minority communities. As a patient advocate, healthcare consultant, and cannabis educator, I asked this committee to see the benefits that a cannabis caregiver program would bring Minnesota patients and our craft cannabis farmers and home growers. Please allow patients and these craft home growers to flourish under new home-grown cannabis laws and not define these stewards of the plant as criminals by definition. Minnesota patients should not be forced to depend on gifting of our medicines if we cannot successfully produce cannabis crops for ourselves with homegrown and not be forced back to an out-of-state medical cannabis gifting or out-of-state medical companies or gifting.
I'll need you to conclude your testimony, please.
Awesome. Thank you for hearing HF 3766 in this committee. Myself and the cannabis caregiver community are open for negotiations, and I am available for questions. Thank you very much.
Thank you. Our next testifier is Erin Jensen, who will be followed by Adam Wagner. Ms. Jensen, please come forward, state your name for the record, proceed to your testimony.
Chair Stevenson, Adam could not make it today.
Oh, do we have Erin?
This is
Erin.
Eric. This is
Eric.
Yes.
Oh, I'm sorry, it's misprint. Mr. Jensen, state your name for the record, proceed to your testimony.
Good afternoon, Minnesota lawmakers. My name is Eric Jensen. I'm a veteran and resident of Rochester, Minnesota. Today, I'm here to speak on the importance of a medical caregiver program in Minnesota. I was a medical caregiver in Michigan for 3 years. Growing medical cannabis is difficult. It's an expensive hobby to set up, requires a lot of attention to detail and time. Allowing caregivers to grow for only one patient gives patients less access to their desired medication. Michigan medical patients have access
Can you,
to the
sir, can you just pull the mic closer to you, please?
Of course. I'm
Thank you.
sorry.
I apologize for interrupting you.
Michigan medical patients have access to the best medicine because their lawmakers set regulations that would allow for it. The Michigan Caregiver Program allows for state-licensed caregivers to grow up to 72 plants. While this may seem excessive, let me try to clear some things up. There are 3 main stages of cannabis cultivation: cloning, seedlings, mother plants, which is your genetic library, vegetative growth, and flowering plants. Only allowing for 8 plants makes it impossible for caregivers to search for new types of genetic traits and cannabinoids that will help medical patients. I've had patients with severe debilitating genetic diseases, such as muscular dystrophy and Crohn's disease. I have also helped patients with work-related injuries that have left them severely disabled for the rest of their lives. Because of these unique diseases and their symptoms, sometimes patients need 2 to 3 different types of cannabis medicine just to get through their day normally like me and you. An example of this might be a patient with a muscular dystrophy needing pain relief and more appetite during the day to help keep their strength up, and might need a different type of symptom relief in the evening or at night. Most people don't know, but many founding fathers grew acres of hemp with various levels of cannabinoids for many uses. America and Americans succeed when they have the freedom of religion, freedom of where they work, freedom of who they love, and freedom to source their own foods and medicine. Setting low plant count stifles the level of care patients can receive from their caregivers. Thank you for your time and the opportunity to speak today.
Thank you for your testimony. Are there any members of the public wishing to testify to this bill? Seeing none, we'll move. Sir, you can come on down and testify now.
Chair Stevenson, members of the committee, I'm Mark Hughes. Thanks for this opportunity today. I have followed a little bit about this history of the bill, believe it or not. Under the Governor Dayton administration, it was said to be started out with the State Highway Patrol and let them kind of decide as to how we should handle it, and then kind of put out to the General Register as I remember it. And now we are at still the medical care and a social responsibility. The medical care I'm all for and I support it. The social responsibility, I've got an open mind and I support this bill that we're all adults and we'll know how to handle it. The only question I've had on it is when we're driving, your response time on the accelerator and the brake reaction tends to be a little slower and may cause an accident. So all I'm saying is if you're going to use it as a recreational, be careful, use it wisely. Medical, I'm for it all the way, so I support the bill. Thank you.
Thank you for your testimony today. We'll move now to member discussion and questions to the bill. Representative New Brindley.
Thank you, Mr. Chair. And I guess I'd like to understand a little bit better how this would interact with the House File 100 legislation that was passed last session. That already allows for cannabis growing in homes. And my recollection, you certainly know the bill far better than I do, but my recollection is that there are strict testing requirements for cultivators to ensure safety, accuracy, and labeling, whatever it may be. How does this interact with that?
You want to answer that, Representative Hansen?
Thank you, Chair Stevenson, and thank you, Representative New Brindley. Sorry I missed the beginning of your question, but I think I grasped the gist of it regarding testing. Current homegrown cannabis does not require testing right now, and there's actually very, very, very few options for people who are growing cannabis at home in order for it to be tested. And so it's my opinion that setting a different or a higher bar for people with disabilities who simply need help growing their own cannabis at home is not inclusive. And so if the expectation is that all homegrown cannabis must be tested before consumption, then we need to also acknowledge that the testing infrastructure in Minnesota and nationwide, honestly, does not exist yet. I really support expanding testing options to homegrown cannabis once our infrastructure can support it, but I suspect that the vast majority of caregivers and home cultivators worth their salt would definitely utilize this service once it's available, whether it's required or not, actually. And so for now, pushing for testing on homegrown cannabis only for this group of patients who use a home grower is not as equitable, especially when those services don't even exist yet. So I hope that answers your question.
Representative Brindley.
Thank you, Mr. Chair. A little bit, I guess, to put a finer point on it, I'm just wondering, like, why would this be necessary with House File 100? Because House File 100 already significantly expanded home growing, home cultivation. So why is this necessary in addition to that?
So I'll turn over to Representative Hansen, but House File 100 allowed any Minnesotan adult to grow up to 8 plants at home, 4 of which can be mature. This bill allows people who are in the medical program to have more plants and to assign their plants to their caregiver. So if you are there's no way to assign your plants to someone else under the current law. So this bill would allow someone who lives in an apartment building or some other, or just is not able to grow on their own, to assign those plants to another person to grow. And Representative Hansen, I don't know if you have anything you want to add to that. I'm sorry.
Thank you, Chair Stevenson. No, I appreciate it. And I think the conversation is worth having because I don't know that we all necessarily realized who we were leaving out of our home grow program because growing cannabis at home requires such strict routines and patterns and upkeep, and it's a very delicate process. And also the cost of lighting and other materials can be quite expensive. And especially for people with disability, I mean, I'm preaching to the choir on this, and I recognize that, Representative New Brindley, that, we know that people with disabilities have lower incomes and that it is harder for them to access a lot of things. And folks with disabilities need a hand just navigating the world as it is. And this is the hand that they're looking for in order to navigate our current home grow program.
Representative New Brindley.
Thank you, Mr. Chair. Last comment. And I guess I would consider, we talked about things, I heard from the testifiers comments about quality and the craft industry and things like this. I would just question whether or not, given our new structure, given that certainly medical growers have stringent requirements placed on them right now, and under the new laws, there's strict requirements for cultivator operations. I would question whether or not trying these new things and this craft industry, I would question whether or not caregivers are the best place to do that. They're not trained in this. This isn't, and we're treating this as medicine in this situation particularly. And so I would question whether or not this is the most appropriate way to move forward on that. Thank you, Mr. Chair.
Representative Katiza-Watun.
Thank you, Mr. Chair. And Representative Hansen, you've been a tremendous advocate for folks with disabilities across many spectrums, and I think that this bill is no different. Just out of curiosity, and so that I'm understanding the intention of the bill, the caregiver who presumably is coming to a person's home, the plants, they can be kept at the caregiver's home location and not at the patient's home location. So they're not coming to the home to care for the plants in addition to caring for the person. They can cultivate them at a different location.
Representative Hansen.
Thank you, Chair Stevenson. Thank you, Vice Chair Katiza-Watun. Right now, the current bill before us allows the patient who would normally have their plants in their home that they're legally allowed to grow to simply assign them to a registered and trusted caregiver of their choosing. And we do propose increasing their allowed plants from 8 to 16, though as my testifier said, we stand ready to negotiate on that. Of course, we wanted to bring the conversation before you. I would imagine that if a patient does have the space in their home to grow cannabis, that their caregiver, who's picking up medicine from the dispensary from them, who's helping them, may also help them garden a little bit too. So that is already an option for them. But unfortunately, for folks who are living in situations where they cannot grow in their facility, whether it's because they have roommates or other qualifications or landlord restrictions, lease restrictions, or simply their ability level, that then they could have their plants just picked up, moved to their caregiver's house, and taken care of at a satellite location.
Representative Katiza-Watun.
Thank you. Thanks for that. That helps me visualize how this could work a little bit more easily. And then finally, just kind of going through the language, I don't see at this point any discussion on like fee for service. So I mean, it's looking like it doesn't exclude that a caregiver in an existing relationship that they may be being compensated for caregiving, but then that this could be potentially added on above and beyond that. Are there any concerns about that, like from people then being charged with an existing relationship that already is monetized in some way, potentially through insurance or along those levels, like that then they would be charging for this service that they're providing as a part of their caregiving relationship?
Representative Hansen.
Thank you, Chair, and thank you, Vice Chair Katiza-Watun. We do have that existing registration that requires the caregivers, and that's managed within OMC right now. And those caregivers right now, and I think it's important for the public to know this, that these caregivers are doing so for no compensation. They're doing so because it's the right thing to do to help the people who need the hand. And caregivers in all sectors, not just in the context of this bill, but they're in the business, if you will, or the community of helping people who have disabilities. And so our current caregiver program allows them to, like I said, assign a caregiver to pick up their meds from the dispensary, travel with their patient's products, and help administer if necessary, and obtain paraphernalia from a medical dispensary. And so this would expand the opportunity for the caregivers with those plant limits. But really, I fully support expanding a world where we recognize the value that caregivers give to people with disabilities in the medical cannabis program and statewide. We drastically underpay folks who provide these critical services, and we're doing better. This legislature in the last session has done amazing at increasing the pay and on workplace protections and a lot of things. And so this is an area where I would love the support to continue to grow at a model where caregivers can have a clear and defined compensation model that we can all discuss, debate, and agree upon, but that is not part of the bill today. We're building upon the existing caregiver program as it is today, where these caregivers are providing these services at no compensation.
Representative Dotson.
Thank you, Chairman. Representative, question I've got is the caregiver themselves, do they have to actually live at the location that the plants are grown, the 16 plants are grown, as well as, is there a limit of how many clients that the caregiver can help facilitate for? So if they've got contracts for, say, 16 clients, could they then grow for 16 clients that they're helping out?
President Hansen.
Thank you, Chair, and thank you for the question, Representative. Right now, we're open to negotiation on that. I just want to start what I'm saying with that piece of it, that if people have a lot of heartburn about where the bill stands today, please contact me. I'm open to negotiating. As far as where those plants are, the caregiver grows them, it is generally in their home, the caregiver's home, assuming that the patient's home does not allow for it. Now, if, again, like I mentioned to our vice chair, if that patient does have space in their home, then the caregiver could already be helping to take care of those plants in the patient's home. But the caregiver model here allows those plants to be moved from the patient's home to the caregiver's home as like a proxy location for them to grow at. And as far as the numbers go, again, open to negotiation. Right now, we have it set that a caregiver can care for up to 6 patients in our current language right now, but we can, like I said, certainly change that on this one if there's a concern about somebody having 6 times 16 plants. I see the concern there.
Thank you.
Closing comments, Representative Hanson.
Thank you, Chair, and thank you, committee members, for the vibrant discussion. I really appreciate you opening your minds to consider what this could look like. We're doing a really great job at improving how we support people with disabilities in Minnesota, and this is just another step in the right direction, and I appreciate your support.
All right. Thank you for bringing the bill, and the bill is laid over.